to the big developing story this hour. The House of Representatives meeting today on health care reform. Democrats continue to scour their membership for votes in support of the health care reform bill. Party leaders say they think they'll have enough votes to pass it, but today's scheduled vote could perhaps slide into tomorrow or even later. Joining me live now from Capitol Hill is Republican Congresswoman Marsha Blackburn of Tennessee. It's nice to see you again. Good morning.
Good to see you. Yes.
Well, I know that I've asked you before about how the GOP did not make a concerted effort to reform health care when it held the majorities. After seeing what the Democrats have produced, do Republicans wish they'd been more aggressive about health reform when they were in power?
Well, you know that hindsight is always 20/20, isn't it, Alex? And the thing is, we made these attempts and have had these bills and have pushed forward on issues that actually passed out of the House on bipartisan support. Liability reform, association health plans, small business health plans, and also competition across state lines. There's agreement on that. Those are provisions we have passed in the House with bipartisan support. In 2006, they went to the Senate floor and kind of died a slow death there. Our hope would be that cooler heads on the Democrat side will prevail and that more moderation on their side will prevail. And they will get rid of this 2,000-page monstrosity that really is a government takeover of health care. And this bill has not even had a hearing, this latest version of the bill, that they will push that aside and they will come back to the table and we can put these good ideas that would reform health care in a patient-friendly, taxpayer-friendly way. Put them back on the table and actually have a good debate about them.
Now, Congresswoman Blackburn, I don't know if you, in passing, said hello to Representative Bruce Braley, who was just there, and during my conversation with him, he said that many things that Republicans put forth in the three committees that did a lot of deciding on this, many of those were included in this health care reform bill. Are there things about which you are pleased?
Well, actually, what happened was those amendments were stripped out. We were in the Rules Committee last night. I was there until after about 10:15, and we were going over some of these amendments. A great example of this is Congressman Walden's amendment on rural health care. That passed by a voice vote when we were in Energy and Commerce Committee. And then when the final 2,000-page bill comes out, guess what? The amendment is nowhere to be found. So that is why Rules Committee met into the wee hours of the night. Alex, those things were taken out of that bill. A new bill was written, and that bill has never been to a committee for a hearing.
Okay, so what Representative Braley said was the truth at some point, but when all is said and done, these things have, in effect, been taken out? These Republican...
They've been taken out. That's correct.
Okay. Can you tell me some specifics of what they were?
Well, as I mentioned, you have the rural health care issue.
Rural health care.
There was some Stupak Pitts language. There was also some veterans provisions that were brought forward. These are things just from our committee, Energy and Commerce. The two other committees, Ways and Means and Education and Workforce, they also had some provisions that they had concern with. And then we had simple provisions, Alex, that we wanted to have heard, like my amendment that would say no federal bureaucrat can make a decision that would ration health care. Also, on unfunded mandates, one of the things we're hearing from our state officials is the way they are expanding Medicaid, it is going to drive this cost through the roof for our states, and they're shifting this federal cost to the states, which have balanced budget amendments, and they're saying, states, figure out how you're going to pay for this. Well, we know what's going to happen. States that have income taxes, states that have sales taxes, states that have property taxes, the taxpayer is going to be left footing the bill.
What would be enough to get you to cross the aisle, you or any of your Republican colleagues, and vote in support of health care reform?
Well, the point is this. There are health care reform provisions that we are for, but we are for dealing with these insurance market reforms, insurance market accountability, and doing it in a way that doesn't break the bank. Their bill is a $2.4 trillion bill, according to the Congressional Budget Office. Their bill would raise the cost of insurance premiums. Our Republican alternative, which will be presented today, according to CBO CBO scoring would lower the cost of health insurance premiums. It would not increase the deficit. It would not increase the debt. And it would save the average American family over $5,000 a year on the cost of their health insurance premium. And that's the CBO score, which has looked at both bills.
All right. Republican Congresswoman Marsha Blackburn of Tennessee, a good day to you, and thanks for joining us here on MSNBC
Thank
Saturday.
You. Good to be with you.